Yeah, so I think that people not trusting how quickly this vaccine was able to be offered is probably the number one thing that I hear from people in terms of their concerns about the vaccine. Which makes sense to me because we know that when things are rushed, quality gets lost. And when we're talking about this vaccine, the quality means like the safety of our bodies. So there's a lot of different reasons that this vaccine was able to be produced way faster than any other vaccine has been in the past. The first is that we actually had the template for this vaccine already created. So people have been working for about 10 years on creating these new mRNA vaccines. And so when it came to COVID-19, all that they had to do was take that template that already existed and tweak it specifically for this virus. The second is that there were more resources poured into the development of this vaccine than any vaccine before because COVID-19 crippled every single economy throughout the world. And so every government was willing to put in as much money as was necessary to create a new vaccine. Whereas usually we really have to advocate that on the scientific community end of things in order to get the resources needed for development of new vaccines and medications and things like that. Another reason is that typically scientists are pretty hush-hush when they're developing something new because they want to be the ones who create the new thing and they want to be the ones whose company has the proprietary rights to that new thing. When it came to COVID-19, the scientific community all came together because they had this unified goal of you know what, let's not keep this hush-hush, let's really work together in order to offer this as soon as possible. So scientists were also sharing information and advances on their own development of the vaccine with one another to continue to make it better. So the last thing that I think is really important for folks with this concern to know is that there are a certain number of safety checkpoints that need to be met anytime that we offer a new medication or a new vaccine. That's what that review process is. That's what those large randomized controlled trials are really studying, is does it hit every single safety checkpoint? And the COVID-19 vaccines that are available on the market right now hit every single one of those safety checkpoints that we use for everything else. Just once again, because this is such a huge thing that has impacted literally everybody, we were able to really only focus on doing that for the COVID-19 vaccine and expediting the process to do so. So it has met the same safety standards as everything else that is currently on the market.